This is an ultimate global podcast. Hello, and welcome to our Daily Dose podcast, covering all about day-to-day global affairs. You're listening to Saurabh Kora and George Mavros from Sydney.
Good afternoon to everyone who is joining us from Sydney and around the world. Welcome to our Tuesday's Daily Dose podcast on COVID-19 updates and sports. And in today's podcast, we touch base upon a very key issue, which is definitely a trending one, where we talk about that is a zero COVID case model still a solution for countries around the world. And to discuss about this, we have a very old guest and the brand ambassador also of UGP, Joshua Karras, who is the executive manager at the United Nations Association of Australia, NSW branch. Welcome again to this podcast, Joshua.
Thank you, sir. Great to be here. Thank you for inviting me.
Great. The audience is so fond of your face now, isn't it?
Look, it's gone through many changes, hasn't it? from the COVID lockdown-induced caveman to half that, and now I feel better now. I feel like more myself.
Yeah, that's what I'm saying, that the audience has seen all kinds of phases that Joshua has gone through in terms of his COVID complexion.
COVID complexion, I like that. You, on the other hand, are staying absolutely handsome all the way through lockdown. I don't know how you're doing that.
Well, I'm just waiting for that Freedom Day on 18th of October, and the first hairdresser customer will be Saurabh.
Excellent.
Yeah. By the way, this is a very important topic, Joshua, that we are talking about zero COVID is no longer an effective strategy. From where we were in Australia, where we were targeting that we should have zero COVID-19 cases. And now most of the people in Australia around the world are saying that because this Delta variant is so transmissible, it's really unrealistic to keep it to a zero COVID model. And in fact, the Prime Minister of Australia, Scott Morrison, has said that once we reach 70 to 80% mark and we open up the borders, there is a high probability that the cases will rise. But what we have to prepare for is how we deal with the serious illness situation and hospitalization, isn't it?
Absolutely. That you've said it all, Saurabh. I think in the same way we don't expect to have zero cases during the flu season, for a disease which is less infectious and less transmissible, I think that we should hold the same expectation. It's becoming very apparent that we will never be rid of COVID. It's not going to die anytime soon, or be eradication is the more precise scientific term. We've even seen, and as you've said, in relation to the concept of cases rising, even though when we will reach that vaccine threshold, it's correct that what we need to be prioritizing on, just as we've seen in cases with Israel, who are already there, vaccine cases rose. We will be living with COVID, and the primary, I think, our eyes should turn towards the future in that a flu vaccine can be given along, with a COVID vaccine, and we've got some companies who are working on booster shots for both the seasonal flu and seasonal COVID, as it'll become known. And that's just how we live with it, and that's all we can do. And then life resumes to normal, hopefully. What do you think about it?
Absolutely. And what I also feel is that at some point of time, the countries have to make that strong call that we need to open up. But there are big questions coming up from countries like Singapore. I think I discussed with you last time also that Singapore has got 80% vaccinated. But there is a further report coming from Singapore in the last week. After reaching 80% double vaccination rate, they in fact opened up their borders. Not their borders, but the domestic restrictions. But after opening up the domestic restrictions, there were 555 new local cases in one day, which is the highest since August 2020. And in fact, they are now thinking to revert back to the lockdown restrictions, even after being 80% double vaccinated, which is kind of a scary element to think about, because in Australia, we are talking about a Freedom Day on 18th of October once NSW reaches 70%. And here is Singapore, which is double vaccinated 80% and is thinking of reverting back to lockdown restrictions.
Yeah.
And probably they are talking about that there is still a need to wear masks, have that physical distancing even after you are double vaccinated.
Well, of course, yes. We know that there are still cases where, the breakthrough cases is how they're referred to, when people with the vaccine who are double vaccinated still become ill. But as you rightly said, the cases of hospitalization dramatically drop. And in the same way that, if we think back to pre-COVID, it's not like the concept of personal hygiene and washing your hands after shaking hands and whatnot. That was there, in the same way that, we knew that we didn't want to get sick from any number of other communicable diseases. I think that we will settle in post-COVID with an understanding that we will just have to think about that a little bit more forever. And in relation to what you said about Singapore, it's a very case by case basis. We will have variants that are, as we travel through through time and experience more infectious and less infectious variants. I think it will just we will just have to live with it. And I don't know if lockdown is the answer, because to what end are we in lockdown if we consider it that way? Do you agree with that? The idea of to what end?
The idea of lockdown, I don't think it's bad, because what it's doing is just reducing the rate of transmission that is happening. As we all know that the Delta variant is highly transmissible, and maybe 4 or 5 times transmissible than the original Alpha variant that we had. So considering that the Delta variant is, raising a higher chance of you getting into the hospital or your chance of dying, that's more critical for us. And
Exactly.
most of the reports also suggest that had NSW, had New South Wales not gone into lockdown on June 25th or June 26th, there could have been easily thousands and thousands of cases per day in the initial few days itself. And we could have been in a miserable situation. So definitely lockdown is a great step. But the question is still, what time is the lockdown a great step? Because if we see that in United Kingdom, they opened the lockdown when their population was 54% vaccinated. In other European countries like Denmark, we have 70% of vaccination rate achieved, and they have all the restrictions open in Denmark. Now, Australia is still on the safer side when it says that we will open our borders when it is 80%. But is 80% also the correct mark is the next question after we are seeing the situation in Singapore.
Look, from what I've heard and seen and spoken to with my colleagues and whatnot at the Faculty of Medicine, it would suggest that 80% is as good as better. Obviously, with 90%, it's a little bit better. But we have to consider the needs of the state and the concept of herd immunity coming into play as well, of course, for those who are unable to get vaccinated. And I want to stress at this point that please do not consider yourself someone who will just rely on herd immunity. Herd immunity really should be reserved for those who genuinely cannot take the vaccine for one reason to another, whether it be allergies or a pre-existing condition or an immunocompromised deficit disorder. Any one of those, it's for those people. We're protecting those people in our community. So I think we should consider the idea that 70% is what's going to happen. That's what we've committed to. And 80% for opening borders is at the earliest possible time when it is okay to do. I feel like it's okay. And I think that we are approaching the time for us to just resume life as normal.
Absolutely. Who else does not want to get back to normalcy after getting into lockdown for more than 3-4 months?
Absolutely.
These are the questions which we have to answer, and maybe people like you who are doing research in medicine might need to research more and understand how and when we should open up the lockdown and how we can deal with the new variants in the coming times. But another critical question, Joshua, is related to this fact that we are talking about opening the borders, but we are missing out on the people who are less than 16 years old, because a lot of the countries not even have a clear plan till now of how they're going to vaccinate the kids who are
Yeah.
below 16 years old. Now, yesterday I was reading that UK chief medical officers have made sure that the kids aged 12 to 15 years can receive the COVID vaccine
Mhm.
first dose, but they have again not laid down the plan for the second dose. And even Australia has now said that people who are, or the kids who are between 12 to 16 can take that initial Pfizer dose. But
Mhm.
again, question is that when you are thinking of opening up the schools in October or November, is it really safe enough to send the kids to the schools when they are not vaccinated? That's a big question.
Yeah, I think that obviously the preference is for vaccination. However, we've still seen that although Delta does have an inclination to infect those who are younger than the previous strains, children are still less likely to become infected, or they seem to be able to deal with the disease much more effectively than adults. So I would still suggest that the government's decisions are in line with current health findings. I do think it's safe, or safe enough, so to speak. And as children become vaccinated with their first and second dose, it would only increase in safety from there.
Yeah, and because this is a critical question, it's all on the safety of those children who are going to the schools. And if they are not feeling, if the parents are not feeling safe, then again, we
Oh,
cannot think of resuming the school in the way they were running before.
exactly. Yeah, absolutely.
And we were talking about alpha, gamma, delta. Heard
Yes.
about mu variant from the United States. Few days back, we heard that there is a new variant which has the potential to evade all kinds of immunities by any previous COVID-19 vaccine, and that has also been approved by WHO. This is not what I am stating.
Yeah, yeah,
This is
yeah.
what the World Health Organization has stated.
There are actually two other ones on top, and this is just the nature of diseases. It is normal for mutations to occur, and this is why we will need to take booster shots. But not these booster shots will not be the same vaccine. It will be just like the seasonal flu shot. That we will need to take an updated vaccine every year, and that's just life. That's just how it's going to be, I think, to address these emerging variants.
Yeah. But don't you think now it's the right time for the countries to actually get together on this point? Because this is not a point of one country getting vaccinated, but it's
Mm-mm.
really important, according to
Yeah.
the reports that I've read, that all countries should get vaccinated 100% as soon as possible. I'm just taking one example of South Africa. In South Africa, we can see that they are still not fully confident of taking a vaccination. And somehow there is a huge amount of hesitancy amongst the youth there. Now, what will happen if they are not vaccinated is that might lead to new kind of variants being developed in the coming days, isn't it?
So interestingly, sorry, I'm just putting my laptop on charge. Interestingly, what we've seen is actually um, in relation to individuals becoming vaccinated or not. The research is still out on whether or not uh, unvaccinated people or vaccinated people contribute to the evolution of the disease. So what I would say though, however, is that as individuals experience vaccine hesitancy, a rising phenomenon of unfortunately the modern world, I would suggest that clear communication and patient empathetic listening is what's required to address that type of pandemic, the pandemic of vaccine hesitancy.
Absolutely. And somehow countries like South Africa and also Zimbabwe, Zimbabwe has tried a very weird sort of a technique, which is mandating the vaccines on the people. And in fact, one news report from Zimbabwe suggested that the government has said that if you want to work in the service sector, you need to get vaccinated, which is kind of a very strong mandate in Zimbabwe. We have
Yeah.
not seen any kinds of such mandates happening in countries like Australia, Singapore, New Zealand, because I think more ease you give to the people, more flexibility you give to the people, people will would like to get vaccinated, but if you try to force them to do something, that's where the problem arises.
Absolutely. I think that it is a very precarious area where very careful policy work needs to be considered. There isn't enough data on what works and what doesn't. We've seen previous policies in Australia of no jab, no pay, no jab, no play, no jab, no play. So where parents don't receive benefits if their children aren't vaccinated, and children can't go to preschools if they're not vaccinated, and they've all led to, yes, an increase in vaccination, but what that has done is lead to a reinforcement, a doubling down of anti-vax communities, so to speak, where these pockets of communities live and engage amongst themselves, leading to micro outbreaks and, unfortunately, sometimes the illness or sometimes death of children. So, and which is exactly what we're trying to stop, to prevent. So there are, using those as examples, there are very serious considerations to be made about engaging in conversations about mandatory vaccination and whatnot. It's scary, isn't it?
It's absolutely scary. But we are not here to scare the people. We are actually trying to have this discussion so that we can look at all kinds of perspectives at Ultimate Global Podcast from different parts in the world, so that even if it arises in your country, if you are listening to us from India or Africa or Europe or Australia, then how can you be better prepared for the situation? Now, when we are talking about Singapore, which is already running ahead of us, it's so important for us in Australia to understand that once we are 80% vaccinated, is it actually safe enough for us to open up? And if we open up, then what kind of restrictions will still need to be in place by the government so that we can make sure that the cases do not rise in a manner which become uncontrollable for the government in the future?
Absolutely. I think the first thing is the at-home quarantine, which is being tested and is proving successful in Adelaide. So, of course, people who visit our country will need to engage in hopefully what will be at-home and free quarantine. That will be, I think, a critical step, because people will bring COVID with them, and it's important that they have the ability to get over their illness for 2 weeks. In that 2-week window, that's something that will absolutely need to stay. The vaccine passports will occur next month. We've been told by the federal government that will occur, and I think that it's important to remember that vaccination passports are not new. They have been around since the electronic passport was invented for various countries that require various immunization programs and statuses for returning home. So I think that will be another step in ensuring the safety of Australia as we engage in opening up our borders.
Yeah, and vaccination passports, and also carefully selecting the countries with which you are opening up the
Yeah,
border
absolutely. Yeah,
is
that's a good
going
one.
to be the key to success. Before we end the daily dose, Joshua, I would love to know, after these serious discussions that we had, what is going to be your first thing that you do when NSW Freedom Day is being celebrated on the 18th of October?
What a great question. I actually was thinking about this, and I made a video about that. It's so overwhelming that what my wife and I did last night was we picked 3 activities that we wanted to do that are under different themes. So firstly, natural speaking, we're going to go to the figure 8 pools in the Royal National Park. For a restaurant, we're going to go to a place called Social Hideout that we've been wanting to go to for a long time. And as an activity, we're going to go to the Paddington Reservoir Gardens. So that's our plan. Those are the first things we'll do in each category. And so now that we don't get overwhelmed by the options that we have, I think it's important to take it slow as we have handed back to us these freedoms. What are you going to do?
I've already told you about the first thing is going to be go to the hairdresser and get
Of course.
yourself proper haircut after 4 months.
Yes, goodness.
It might take half an hour, 45 minutes, but that's going to be the most relishing haircut I've
and
ever
10,
had in the year 2021.
and 10 kilos of hair just around the floor. You can make a whole nother hair, Sarab's hair on the side.
Absolutely. By the way, just for the audience, before we end this daily dose, I want to tell you that Joshua is running a magnificent show on his Facebook channel called Joshua's Lockdown Lowdown. So don't forget to go to his page, also his Instagram page. He's doing an incredible job for the people during the lockdown by making those 40, 50-second snippets, and the way he entertains people is so phenomenal, and I'm a big fan of that. I keep on liking that a lot. I'm sure all of you will also like that, so do follow his channels. I'm sure that he will not keep you bored even for one day.
Thank you, Sarab. Thank you so much for that.
Thank you so much for today's participation, Joshua. We hope to see you next week on the same topic, on a different discussion. Maybe we see that till that time NSW has crossed 50% double dose.
Absolutely. Well, looking forward to speaking then, Sarab. Thank you so much for having me.